Hello again, Sean Scorvo here for another informational video on COVID-19. We're now 2 weeks into the growing realization of what COVID-19 means to our health, our families, and our society as a whole. Unfortunately, our planning continues to be tainted by misinformation coming from the White House. Dr. Fauci has been sidelined, and even the CDC updates are either watered down or contrary to the medical literature I'm reading. It shouldn't take a doctor with a spreadsheet in the Oregon countryside to call BS on the information coming out of the White House, but that's where we are. As a retired physician, I urge you to make your future decisions based on information from your state and local leaders only. Now let's focus on today's topic, ventilators. The president is complaining that New York does not need the requested 30,000 to 40,000 ventilators. So let's look at that. Will the number requested be enough? Will the delays so far take lives? To answer those questions, you need a little background on ventilators. A ventilator is a machine that breathes for a patient who isn't able to do so on their own because they're unconscious, because the work of breathing is too strenuous, or because the lungs aren't able to oxygenate the blood without help. The machines allow a physician to deliver a set volume of air at a desired pressure according to the patient's size, weight, and underlying medical condition. These machines are complex and expensive, with components coming from multiple states and countries that are experiencing their own outbreaks and disrupted supply chains. Going back to New York's request. New York has close to 20 million people. With moderate social distancing, they are likely looking at 200,000 people who will need a ventilator. At the peak of cases in that scenario, New York will need 12,500 ventilators per week. The state currently has 4,000. If, as the president now wants by Easter, social distancing is disregarded, the number of necessary ventilators in New York State alone triples. And it's important to remember that this is only the number of ventilators needed for COVID patients. It doesn't count the ventilators needed for care of all the other critical care patients. Hence, New York's request. It's valid, and it may very well be a little conservative. If you're thinking to yourself, I don't need to worry because the president ordered GM to make ventilators yesterday, you need to know that the components that go into ventilators are already in short supply, as the world's logistics chain has been upended. So our ability to fulfill even today's need is highly suspect. Even the ventilators we do have on hand are likely to run out of the disposable components that are replaced weekly and between every patient, and that risks other types of infections. Closer to home, I'm still in contact with people from my days as a physician, and they're also raising alarm bells about a lack of ventilators. That concern spreads to House District 23. We can likely expect about 700 will need a ventilator here. Given the length of ventilator care necessary for the critically ill, we need 21 ventilators, and we can likely only muster about half that number. If social distancing isn't practiced, that need blossoms to about 50 plus ventilators at the peak. In summary, ventilators are complex, we need a lot, we can't get them, the requested numbers may be conservative, and we're about to have problems serving the ones we already have. Basically, the federal government is months late and even starting to address the problem. Based on all that, here's today's request. Don't let the president prod you to disregard social distancing. It will worsen the problem. People will die. Now, unfortunately, I need to be a little bit political. Though I'm not your elected representative, I feel compelled here to use my candidacy as a platform to provide thoughtful, scientifically based information. Why? Because I haven't seen anything like that coming from HD23's elected representative. And I hope I've convinced you that the White House's information isn't to be trusted. Mr. Neerman has released no official guidelines, no recommendations based on his communication with elected officials and state agencies, no mention at all of COVID-19. But we did receive a thoughtful letter on March 18th complaining about PERS, quote, fluffing the budget, and his rationale for abandoning his constituents when it came time to negotiate the cap and trade bill on their behalf. To Mr. Neerman, I say, lead your district like you were elected to do. Digest the information coming to you from the state and get it out to your constituents.
Your history of not engaging people within the district, whatever your rationale, needs to be pushed aside. As the district's elected representative, you have access to additional information that can help. You have relationships with people that trust you. Speak to them. Every conversation has the potential to save lives. History does not look kindly on weakness in times of trouble, and right now your silence is weakness. So do your job and speak up. Don't be shy. It's not so scary. And finally, in the absence of leadership from the White House and in the district, we need to focus on taking care of ourselves, our families, and our neighbors. No one's riding to the rescue here. Towards that end, we will be posting a link to resources in the video description, so please make sure to read that. And if you have additional resources and requests people should be aware of, please post them in the comments. Thank you.